Hey guys, welcome back. This is Aditya. It's been a while. It's been almost, I don't remember how many months or years, probably, I think, since I've posted consistently on my channel. I'm sorry, big apologies. But the thing is, I just completed my residency. Not just, well, it's been a few months. And, well, I'm a foolproof surgeon now. I've completed my MS General Surgery. And it's been almost 10 years, I think, better part of a decade since I started my medical journey, since I entered MBBS. And, well, it's been a hell of a journey. A lot of ups and downs. More downs than ups, but it's all good. And I'm here to share my few pearls of wisdom because I've learned a lot along this journey. So as I was entering, I was barely 17, didn't know a lot. Everyone in my family is a doctor, so it helped a bit. But it's very difficult. I mean, I was naive. I didn't have a roadmap or a guideline to look forward to, and I hope I can give you that with this channel. And you can hit me up anytime on Instagram or Twitter or anywhere you can find me. That's the thing. Now let's get directly to it. Now here are a few things I think I should have done in my MBBS journey. First thing, not using the right study technique. So as we all know, perfect gold standard technique for studying is active recollection and spaced repetition. So what I did was I just read textbooks non-stop, and there was no revision, there was no planning, just reading all the time. I was sitting in library for hours on end. Just after college, I was going right to the library and I was sitting till I was sleepy, and I would go to my room and sleep. That's it. So I was studying hard, but I was not studying smart. That's where the problem arose. So what you should do ideally is, obviously you should plan how to study, but in doing that, you should, if suppose you have a lecture, so you should ask yourself a few things that you know about this topic. Suppose anything. Suppose the topic for tomorrow's lecture is, suppose, tuberculosis. Ask yourself what you know, because our brain is such huge. There are so many neurons, so many connections between these neurons. So we know some of those things. So we have to recollect what we already know, and then we can either obviously test ourselves. You can recollect it yourself, tell a friend. The next thing is to plug these gaps, what you don't know. Now you're aware of what you know and what you don't know. So obviously the next step would be to read standard textbooks, so it'll plug those gaps. And obviously if you have a lecture, attend this lecture, and you'll understand a lot more as compared to if you were to go without reading or without knowing anything about this lecture. So there's that. We can use flashcards, you can solve MCQs, you can do a lot of things. All are kind of active recollection things. The best thing I think is to find a study partner and to share or to study and discuss topics. That way you are accountable. You can treat each other as Viva partners. You can take each other's Vivas. That's how you learn, I think. So but that's the one thing I think I should have done. Now the second thing, I think I mentioned it a couple of times, not planning. I didn't know how much to read, how many times to read. After I mentioned active recollection, I also mentioned spaced repetition, that is revision. Our brain doesn't normally, unless you have a photographic memory or something, you can't recollect and store topics like, someone has a photographic memory. I don't know. I mean, I know I don't. Most of the viewers who are watching also probably don't have that. So we all need to revise our topics from time to time. So there's a thing called as a forgetting curve. I'll post a picture of the same. So in the forgetting curve, within like a day or two, within a week, and within months, we tend to slowly forget things what we learned. So we should revise from time to time. And again, the best revision technique is, again, discussing. I think I'm drifting from the topic. Not planning was the second thing I think I should have told. So in this thing, again, and I think I'm repeating a lot of words. Sorry, I'm doing this after a break. I'm kind of new, so yeah, please excuse me. So the second thing is planning. Yeah, you should ideally target at least 4 or 5 readings of standard textbooks. So there are either conceptual books, which are standard international authors books, and there are exam books. So I'll make a list of the books I used, whatever, and post it here. But the thing is, the conceptual books, for example, Robbins for pathology, I don't know, just the good books, Love and Bailey for general surgery. These are the books which are like the Bibles of this subject. So you should read them from time to time. And if you quote these exact books in the Vivas, you'll get good numbers. But apart from that, the concepts you will develop will be crystal clear. So that's the second thing. Third thing is not networking enough. So I did my MBBS from State GSMC and KM Hospital, which is like one of the best premier institutes in the country, and it's like a conveyor belt for one of like brilliant minds in the country and like one of the best institutes for producing doctors. So obviously I was surrounded by a lot of brilliant people. I knew I probably couldn't like beat them, probably IQ wise or intelligence wise. So that's not important. The point is I should have done more networking, because I know these people, like few of those people that I know or probably I might know in a lot of depth will exceed in life. I know they'll reach a certain point and they'll contribute. So having these people in your contacts will always help you, not the other way around. Now the fourth thing I think is not enjoying enough, because I was too uptight. That was part of my OCD as well. That's the thing, you have to maintain balance in life, because the time won't come back. The time you have with your friends, time you have with your parents, and supposedly if you have a partner. So obviously studying is important, career is important, being like driven is important, but you have to find the right balance. You have to take time for yourself, you have to enjoy, go out, have dinners. Obviously I did that, but I don't know, I was not maybe present in them as much as I would have liked. That's one thing I regret. And the last thing is not discovering myself enough. So obviously self-discovery is a dynamic thing. It's a never-ending process, and you are discovering yourself till your very last breath. So yeah, I mean, it's an infinite process. You can never completely discover yourself. That's the beauty of it. But the thing is, I was so engrossed in studying and wanting to prove myself in a different environment and different group of people that I forgot to discover myself, and that kind of bit me in the buttocks later in time, because I didn't know what my triggers were, didn't know how I react to stress, how I react to different things, how we should interact, how, just the basic things. I think I should have given time to those things as well, again, just going out and discovering things for yourself, probably hobbies or different passions. I did that a bit later, like in my third year and final year. I did participate in things. I lost a bit of weight, like 10-15 kgs I think I lost. Did a body transformation. I did triathlons. I did so basically I did a few of those things, but I think I should have done more. In second year as well, I think I did participate in dance and stuff. So yeah, I mean, I did okay, but I feel obviously I should have done more, because again, time never comes back. And the thing with MBBS is it's your college life, man. That's the time, that's the 5.5 years, or at least 4.5 years you'll have to really enjoy, because later on there is internship, there's NEET PG race, or even next whatever your exam will be. So there's a lot of rat race after you finish your MBBS, or even in MBBS there is rat race. So you have to maintain your own sanity. You have to know what things you like, and just keep on discovering yourself, little things. I later discovered, I always knew that I was an artist, have an artistic side to myself, but then I started painting. I really love to dance. Now I'm finding a new passion in singing. I play a few instruments as well. So there's few things that really enrich your soul, and you have to it's not important to post these things or let the world know that you're doing these things, but just do it for the sake of enjoying and finding that passion, finding that life within that. So that's really important. So there's that, and I'm done with the video. I think so. I hope this was informative and helpful, and please like, share and subscribe so I can post more such videos. I'm thinking of doing a series for MBBS and for PG students, specifically catered to Indian students, because obviously I've done my UG and PG in India, so I know what are the struggles and the different things that Indian students face. So till then, ciao.